Okay, well, Suzanne, I am concerned about what you're telling me about that episode of depression you had just a few weeks ago, and the fact you're feeling kind of edgy and agitated the last few days enough that you couldn't stay at work. My concerns here are that this might be something a little more significant than a simple depression, which we had already talked about earlier in our visit here. My concern is this may be a presentation of bipolar disorder. And bipolar disorder is a mood disorder where sometimes you can be edgy and agitated and even very hyper feeling, and other times could be weeks later or only days later or months later, you can feel very depressed. And it kind of oscillates between the two.
Yeah, that resonates, yeah.
And for every patient who has really pronounced symptoms, we see a dozen that have much milder symptoms. Yours are actually pretty mild. I know they feel awful inside for you, but in fact, they're much milder. Nonetheless, we have to use treatments that are going to be appropriate for you. Okay. So kind of our standard antidepressant medications that we talked about, like Lexapro, probably not appropriate for you. What I'm going to do, just to clarify this, I'm going to have you take a couple screening questionnaires. Okay. One's called a mood disorder questionnaire. It's actually a screen for bipolar. And the second one is called the mini, and it's actually a more general screen for depression and anxiety, things like that. Only takes about 5 minutes to do. I think you'll be done just about the time I come back in with Jennifer along with me. Jennifer Sale is our behavioral health consultant, and I'm going to ask her to talk with both of us a little bit today about this, see if she has any additional insights into what's going on with you. I want to make sure we give you the proper treatment. So,
okay, great. Okay. Thank you so much.
Yeah, so I really want to reassure you we're going to get you help today, and you're going to start feeling better today, okay?
Thanks. Thanks a lot.
Good.
Thanks.
Okay. Oh, thanks for getting those done for me.
Okay.
Yeah, Suzanne, I'd like you to meet Jennifer Sale.
Hi, Jennifer.
Yeah.
Hi.
Yeah. Jennifer is our behavioralist or behavioral health consultant. She works right along with me during the day. And I'd like to go over your case with her and the results of the questionnaires that you just did. Suzanne is actually pretty new to our practice. This is only the second time I've seen her. And she's had what sounds like oscillations between periods of depression that may last weeks or months, and then she'll be really agitated for a week or two, sometimes really have a lot of trouble sleeping, and then go back into this kind of depressed state. And this has been going on intermittently like this for a couple of years. We actually think there may be a family member, her mother, who had very similar symptoms at one point during her life. Just in looking at her screens here, I've got her mood disorder questionnaire, which is completely positive. Every single question was answered with a yes. And on her mood disorder questionnaire, all her anxiety indicators were positive, as well as her depression indicators. So what I'm going to do right now is leave you with Jennifer for a chance for the two of you to talk. Actually seeing the results of all this, I think what I'm going to suggest to you today is that we do start you on some medication right away that's going to help you feel better. I can feel how agitated you are with all this.
Yeah.
And the medication I'll suggest for you today is called Seroquel. It's one that you will take at bedtime, and we're going to aim for an initial dose of about 300 milligrams. You'll see it'll ramp up very quickly in the little starter pack I give you today.
Okay. Yeah.
And when you get to the full 300 milligrams, I think you're going to start seeing a lot of the positive benefits of this. And I'll go over the side effect issues and things with you in a few minutes. I won't take the time now. I'd like you to have a chance to talk with Jennifer, and then she and I can consult a little bit at the end and make sure we're all on the same page with this.
Great, thanks.
So
I really appreciate it.
I just want you to feel like help is on the way with all this.
Thanks. Thanks a lot. Great.
So Suzanne, these mood fluctuations must have been pretty distressing for you. You've been dealing with this for a while now.
I have, and it was just like over here, and I can't deal with it.
It's really difficult, yeah. So you've been feeling kind of edgy and upset.
Yep. And then I get totally depressed. It's like I can't get out of bed, you know, and I just do nothing and be nothing. It's like over here and then over there.
Oh, that must be really difficult.
Yeah.
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 Okay. Well, I'm glad to be speaking with you today because I think there's some things we can do to help you.
Great.
Yeah. In the behavioral health program, I can see you weekly, bi-weekly, whatever's needed. The sessions are about a half an hour. And we can start looking at some specific behavioral techniques that can help you feel better, both with your depression and your anxiety, some different ways to think about things, some cognitive techniques. Definitely would like to help you learn some relaxation exercises.
Wonderful.
To calm that anxiety down a little bit. In fact, just real quickly today, before we leave it, I can't do a full session with you today, but deep breathing can be really helpful. Something called diaphragmatic breathing or belly breathing. Long, slow, deep breaths in and out through the nose. And sometimes you can put your hand on your belly so you can actually feel it lifting and going back and so on. I'll explain a little bit more in detail the next time that we meet, but just to start you off with something, that deep breathing can be really helpful for the anxiety. So you can just try a little bit of that before we meet again.
Great. Okay, I'll give it a try.
Okay, great. And we'll set up an appointment for you.
Thanks.
today.
Thanks a lot.
You're
okay.
welcome. You're welcome.
Okay. Bye-bye.
Bye.